Member for Peace River North.
Thanks, Honourable Speaker. Every day we hear stories of the crisis in our healthcare system. Every day we hear stories of the shortage of healthcare workers. But at a time when we need all hands on deck, thousands of doctors and nurses who want to work are sitting on the sidelines. Since June of last year, the official opposition has repeatedly urged the government to provide a pathway for all British Columbians to return to work, just like the federal government and nearly every other jurisdiction in Canada. There is no reason why we cannot follow their lead, especially with safety protocols in place. So on behalf of the tens of thousands of British Columbians waiting without basic health care, when is this Premier going to allow these doctors and nurses back to their jobs so that they can provide the care that people desperately need?
Minister of Health.
Honourable Speaker, the actions that have been taken in British Columbia against the COVID-19 pandemic in support of people who are most vulnerable, I think, have led Canada and have been leaders in the world. And the reason they've led Canada and been leaders of the world is that provincial health orders have been directed by the provincial health officer with the support of myself and the government. We have, Honourable Speaker, in British Columbia, vaccine mandates in place because people who are in acute care and people who are in long-term care and other circumstances are the most vulnerable to COVID-19. And so we have and we continue to take actions to protect them. And we are and going to continue to do so. I understand it's the position of the honourable member, and this is a public debate, and I say it with the greatest of respect because I've never criticized anybody for taking a contrary opinion to ourselves or Dr. Henry or anybody else. But what he's suggesting is that we overrule the provincial health officer on a matter of public health in a pandemic. I don't agree with that. And, Honourable Speaker, not take due care for people who are the most vulnerable to COVID-19, those who are in acute care hospitals as we speak and are in long-term care. I disagree with that. So we have a...
Members. Minister will continue.
And we're going to continue to take steps to ensure that we keep people safe in this public health emergency.